Peace be to you all. Assalamualaikum. Omar here, physician associate, health educator, and endurance athlete. So this evening I'm going to talk briefly about the role of nursing. It's Nursing Week, so happy Nursing Week to all you nurses out there. I think it's from May 9th to May 12th. And we're now in May 11th as of the shooting of this video. So you got one more day left. But that doesn't mean that the appreciation for nurses should stop there. Now I'll tell you a bit about myself. I've been in the healthcare field for a little over 30 years. I got my start in nursing as a certified nursing assistant, working my way through nursing school with the intention of going to medical school. I didn't really know about PAs at the time. And then my mother is a retired LPN. She was a nurse for 43 years before retiring, and worked in many different capacities as a nurse. So the nursing profession is a great profession. As of 2021, there are about, it's a little over 4 million nurses. I think I saw 4.3 million RNs and about 950,000 LPNs. The difference is in the length of education. So for a licensed practical nurse, you may hear it also referred to as an LVN. So I think that's a licensed vocational nurse, if I'm not mistaken. Those programs tend to go from 9 months to about a year. For an RN, there is an associate's degree, University of the District of Columbia. If you're Go Firebirds, they have an RN program, so a registered nursing associate's program. A lot of the 2-year programs are getting phased out, and it's now an obligatory BSN program, so a 4-year nursing degree. If you do a nursing major, you're going to be taking classes like Essentials of Biochemistry, Anatomy and Physiology, some Pharmacology, and then your nursing courses like Med-Surg Nursing. That was my downfall in nursing. I failed the course by 1.5 points because I failed my final exam, which was like 70% of the grade. If you didn't pass that, you had to take a whole nother year and wait to take Med-Surg Nursing again. I went back on the exam, changed my correct answers to the incorrect answers, and I'll never forget Miss Robertson. Mr. Abdul-Malik, you failed yourself on this exam. I can see where you changed your answers. I was like, ah! So for me, instead of waiting a whole nother year to take medical surgical nursing again, I just finished my bachelor's degree and then applied to med school. But with your core courses for nursing, you're going to take medical surgical nursing, pediatric nursing, psychiatric nursing, some surgical nursing, and I think there's another course, maybe geriatric nursing at some schools. And then you rotate for a couple of weeks with each specialty course through a hospital or clinic. And that's always fun. I did that for my primary care. I did make it through primary care nursing, so I rotated through a hospital. And you learn a lot. You learn a lot of nursing skills, and you're going to interact with the patients. Of course, how to write your SOAP note, and that's going to be a very specific skill set that nurses have. But you learn it. If you go to medical school or PA school. It's in nursing. It's the actual becoming a nurse is very stressful, but it can be a lot of fun. So if you take your courses, that's one of the first times I saw grown men cry because I had male nursing classmates, and we were having problems with this course called it was Math for Meds. So if you've ever taken that and you're a nurse, you know how much emotional trauma that can cause. But you have to figure out things like drip rate for IVs. This is very important because if you're going to do ICU nursing, you really have to understand concepts like drip rate. There was and then how to correctly identify different medications and mix them. There was an unfortunate case with a nurse whose actions or inactions accidentally led to the accidental death of a patient because she gave the patient an incorrect medication, and it was in one of those particular times where it was a lot going on at the time, and the nurse was having problems with this as a program called a Pyxis program. You've got to program the computer, override the computer to actually release the medication. But it was unfortunate. She gave the patient the wrong medication, and the patient died. So I think she was eventually charged with negligent homicide, and her case is coming up. But that shows you the importance of the nursing role. You can do a lot of good, but you can also do a lot of harm if you are not careful in what you're doing. So that's why the nursing programs have got to be so rigorous. After you finish your nursing, your didactic and your clinical nursing, you sit for the NCLEX that allows you to be certified as a nurse, and then you get your license and then start to get to work. Part of me kind of wishes that I'd at least finished at least the associate's program, so I could have worked as a registered nurse. It's a great profession right now, according to the Bureau of Labor Statistics in the U.S. The nursing salary is about $60,000 a year, but you can make a lot more than that. I know my mom as an LPN made more than that, during the 70s and the 90s, because she was an experienced LPN. You can do moonlighting. You can go on and advance to become a CRNA. I covered that in some prior videos. That's a certified registered nurse anesthetist, where you're actually putting the patients to sleep, for their surgeries. You can be a nurse practitioner, so that's going to require more training after your registered nursing program, and even those are getting phased out, and the master's degree programs are becoming doctoral degree programs. You can see a video I did with one of my colleagues who's a nurse practitioner. But it's a great profession. If you want, I'll put the link in the description, and you can look at ANA, the American Nurses Association. They've got a lot more information about it. But I've worked very closely with nurses over the years. I've never regretted it. I've learned a lot from them. Nurses are team players, but they're also leaders in healthcare. So happy Nursing Week to those of you all who are nurses. If you are considering being a PA, you might want to consider majoring in nursing. There's a fellow YouTuber of mine, Mr. Kanan Brown, who got his RN degree first, and then now he's a PA student. So you don't want to think of the nursing field as a stepping stone to medicine or becoming a PA or a medical doctor. But it's good training, and it's a good career to be in before you start either PA or MD. That's it for now. I wish you guys the best of success in your positive endeavors. Subscribe if you want. If not, that's fine too. You can reach out to me for shadowing hours, or if you want advice on how to write your personal statement for PA school. All right, take care. Peace.